Hey everybody, it is Jessica from This Week in Global Health again, and I'm reporting from the International AIDS Conference in Durban. Now, like I said earlier, this is just the pre-conference. I've been to events on viral hepatitis, and I also was going to a workshop on meeting the UN 90-90-90 goals for HIV. I've been going back and forth with sessions. There's a lot discussed. I've been here since 8:30. I am tired because there's just so much going on. Okay, so an update from what I was telling you about the HBV discussion. Well, I went to the afternoon talk, which was focused on hepatitis C virus, and there definitely was the focus on policy and implementation and what different countries are actually doing about it and where we still need to go in order to eliminate hepatitis C and get treatment for people. So that was really great to see that at least there's advocacy in the hepatitis C world. Another interesting highlight from the session on hepatitis C was a talk by Dr. Sunil Solomon, who was talking about scale-up of HCV treatment in India. And what he pointed out was we need more than just the scale-up of the treatment. Actually, we need to educate people in India about it. There's a lot of people that have never heard of HCV. He even likened what was going on to how things used to be with HIV, where people didn't even know about the disease or understand it. I've also been going in and out of the UN 90-90-90 workshop. Basically, people here have been discussing the challenges of meeting 90-90 targets around the world, and this has been interesting just to see how in various settings communities are addressing and tackling the 90-90 treatment targets. One of the things that I am really excited to tell you guys about also is the activity from the transgender community. I was in a session this morning in a room that was next to a session for transgenders about the HIV response for transgenders, and I have to say, you could hear hooting and hollering, and I thought, man, I should be in that session. Wish I had signed up for that one. And what I think this says is there's going to be a lot of activity during the conference and discussion about the HIV response for transgenders. Another thing that I saw was a lot of activism already, and the conference hasn't even started, so you can imagine what is going to happen starting tomorrow. I was walking outside where the Global Village will be, and there was an exhibit with a bunch of graves and had RIPs, and what they were trying to send home the message was a lot of community health workers have died in the HIV response, and we need to recognize them and their efforts and protect them and also pay them. I'm about to go back to the workshop on meeting 90-90-90 UN targets for the HIV response. These are treatment targets for testing, treatment, and viral suppression, which is not easy to meet in all settings. This next session will talk about how people are implementing and trying to meet these targets in the US. And that'll be it for today, I think. The Global Village will open, and hopefully I will send you guys a video.